the fourth pillar, stock management. As I said, initially I told you all, adequate supplies are crucial for uninterrupted laboratory operations. What is going wrong? Stockouts of critical reagents, expired reagents, improper storage conditions, and inventory discrepancies. You can't have it. Because of which tests are delayed, patients inconvenience, potential compromise to patient care, and financial losses. So, what does a robust system? What should it have? A proper inventory management system software. Okay, now so many softwares have come in. Initially, I didn't have one. It was all Excel. You don't need to have a software also. You can just have a beautiful Excel sheet on which you can pick it up. Then reorder. You know, okay, when does it come to what age, what stage, then when to reorder. Then when you get the stock, what temperatures it has to be stored, which all has to be stored in what temperature. Then regular stock check. Then from whom are we buying? What is the type of material we are buying? All these things one has to know, and there is a way of doing things. As I said, next, documentation. Complete document, not little by little, because it is very essential for us to trace back and to see whether what happened is correct or not. Regulatory compliance and quality assurance. Very important, because what regulatory compliance people say is, if you've not written it, we assume that is not done. So what do we see? Incomplete records, illegible handwriting. I am one person, very horrible handwriting. So what did I do? I started writing in capital letters. How much can something go wrong in capital letters? Because my own handwriting, I can't read after some time. So we have to ensure legible handwriting. We have to ensure no data entry errors happen, because one person writes, then other person verifies. And non-compliance with regulatory requirement is absolutely so rampant. None of these things are in place, not because people don't want to do it, because they don't know how to do it. And as a result of which, we are not able to verify results, difficulty in troubleshooting errors, patient safety risk, legal. There was one instance when a police constable walked into our lab and he said, "Ma'am, this is around 1.5 years back." And then when we pulled out the data, he was a convict and he was in jail, and he had said he had come for a hospital. He had actually run away or something like that. And then he mentioned, "No, I was not feeling well. I went to the hospital." And you can check the records. And they came to check the records. And this person, so luckily, what he did was, the first name and the second name was the same patient. He sent one patient in the same name, showing the Aadhaar card, and he went and did something else outside. So what I'm trying to say, legal issues, if you don't document it properly, and then we traced it back that the Aadhaar number which was given, and it was a different patient and not him. So sometimes it becomes very difficult. You need to have everything in place. And of course, our electronic laboratory information system, standardized documentation, templates, clear guidelines for record keeping, regular audits, and backup is the need of the hour. In 2000 in Satya Sai, when we had a paperless hospital, 23 years down the lane now, everybody are getting it up. And it is a need, because so much we can do when we have a LI system.